Hello and welcome back to GP Video Podcast by Nadia. So I had a big fall yesterday. I was trying to do something in my daughter's room and I got trapped in the wires and leant face down on the ground with my chin hitting the corner of the TV table and then landing up all on my right knee. So you can see the bruise here. For a second I thought I would have broken my jaw, which thankfully is not the case. But yes, my right knee hurts a lot. And the reason my right knee hurts, of course, I fell on it for sure. But my knees have been weak for a while now. In fact, the reason I had weight loss surgery done, which was back in 2017, I was obese. My BMI was around 32, 33. But apart from that, my knees were giving away. So they were, as you can imagine, that they were the big joints that I always talk about, that the big joints bear all your obesity, all your weight, your hips and your knees. My knees were getting very weak. I was working in the hospital system at that time, and doctors who work in the Australian hospital system, they know that you have to be on your feet almost all the time, running from one department to the other. And also if you're in emergency department working, again, you are on your feet. So that's why I had to get the weight loss surgery done, and that has actually improved my knees a lot. But because the damage has already been done, so whenever I have a fall or I twist them, I actually had a very, very embarrassing incident. Once I was in a wedding, that's back in 2016, and that was of our relatives. And if people who are watching it and who remember this incident, because I had a very, very bad fall on the dance floor. So that was 2016, and at that time I hadn't got the surgery done. I was still obese and I wasn't even dancing. I was just on the dance floor clapping, and all of a sudden, I was wearing heels though, not big heels, just a bit of block heels, and my knee twisted and I had a very bad fall, and then I couldn't walk for a few weeks, and it was so embarrassing in front of so many people. So yeah, that was all about me, but I'm much better today. Yesterday I worked, and then after, when I went back home, I got back home by around 7 p.m. and then I was in bed the whole evening and night because I couldn't move. My knee was quite swollen and this was hurting as well. Now it's just a bit of a bruising there, but otherwise I was in a very bad condition. Okay, so that's all about me. What I'm going to talk to you about today is, I thought that I'll start talking about headaches. How many kinds of headaches we have, what types of headaches we have, how do we treat them? Because I see that in general practice, whoever comes to me, they use the word migraine for headaches. Any headache that they have, they would say, oh, I've got a migraine, or I had a migraine, or I get migraines. Migraine is a form of headache, but it has got its specific characteristics. Not every headache is a migraine. That is very, very important to understand, because all other types of headaches are treated with analgesics, like, pain medications and stuff, but migraines are actually treated specifically. Some people have to go on migraine preventers, one medication daily, and then when migraine happens, you can't treat them with normal Panadol and Nurofen. You have to take the wafers or the tablets specific for migraine. So I thought I will start talking about headache. Again, it's a massive topic, wouldn't just involve one podcast, would involve a few at least, but we can start the ball rolling. And then we will talk about all the types of headaches, and then we will eventually reach migraine, and we will talk about the investigation, we will talk about the characteristics, of course, and we will talk about the treatment. So headaches are primarily classified into two types. So one is primary headaches, one is secondary headaches. So primary headaches means the ones that don't have another cause. They are primarily headaches originating from head. Okay, so number one is, of course, as I said, it's migraine. Number two is tension type headache. Number three is cluster headache. Number 4 is trigeminal autonomic cephalgias, and then miscellaneous. So basically there are 3: tension type headaches, migraine headaches, and number 3 is cluster headaches. Then we've got secondary headache disorders. These include a new headache occurring with another lesion capable of causing it. So for example, any tumor in the brain can causing headache, which is a new headache. Also, the secondary causes could include, any referred pain. So for example, people who've got low like their eyesight is getting weak, they can get headaches. Anybody who've got sinus issues, maxillary sinus issues, frontal sinus issues, they can get headaches. Then any structure in the head and neck, so cervical spine, any problems with the cervical spine, with the neck, can cause headaches. Any problems with the ears can cause headaches. Any problems with any structure like in the mouth, teeth, they can all be referred to the head and can cause headaches. So primary headaches include migraines, tension type headaches, and cluster headaches. And secondary headaches include any tumor in the brain or any referred pain coming from eyes, ears, nose, sinuses, teeth, cervical spine, any ENT infection, or anything that would be called as secondary headache. We will talk more about the primary headaches in our next podcast.